supine cervical index pillar push. We can do a P to A rotation, or we can do a lateral flexion. Let's do the rotation first. Then put some flexion to the headpiece, index contact somewhere on the articular pillar. Take a P to A tissue pull, indifferent hand, contacts the opposite side. Again, we're going to put a little bit of flexion. We're going to laterally flex the neck, get ourselves positioned, rotate the head, and we would impulse P to A, right, for rotation. If we're doing a lateral flexion, then we can keep this more neutral. Again, take a tissue pull from lateral to medial to get onto the pillar. Everything on the indifferent hand looks the same, and we'll just keep his head on here. Laterally flex the patient towards that side. Add slight rotation, and then I would thrust lateral to medial. Right? No,
I'm saying the next one.
Supine cervical thumb pillar push. P to A rotation. Again, we're going to use our thumb. And we, indifferent hand like before. Take our thumb. Take a tissue pull from P to A. Then I'm going to flex up and laterally flex them towards my index. Rotate, I have to keep my arm out, and then you would impulse P to A. What's that?
Is that the chicken?
Yeah, that's the,
Okay.
No, it's not.
that's the
It's a reverse chicken one. Reverse.
Yeah. At that time where we were really good.
we have a supine cervical digital pillar pull, P to A rotation. Those are the digital pillar pulls. That would be, I guess, the way you guys learn with Dr. Good. You take your Cairo index, finds the pillar on this side, right? You can put a little bit of forward flexion, you can laterally flex, you can rotate and pull, right? What do we have next? A supine cervical index spinous push, A to P rotation. Now we're going to use the side of the spinous, that index. We're going to take our contact and slide down to get onto the side of the spine, the side of the spinous here. Remember, we were going to flex the head. We laterally flex, we ipsilaterally rotate, and we impulse A to P. You guys don't like. Yeah.
Show that one more time.
Okay, that's fine. We slide down to get on the side of the spinous. We flex, we laterally flex, and now we ipsilaterally rotate and impulse A to P. Supine cervical index spinous pull for an A to P rotation. Now we're pulling the spinous before we pushed it. So now, let's say the spinous is on the left. We'll take the Cairo index and we'll reach to the left side to grab onto the spinous. If it reaches across, grabs the spinous, I flex the head, I laterally flex, I rotate with my Cairo index on my right hand, I pull. Right?
Can you stand in front of the patient?
And doesn't
Like, I know,
it
like, with people, we kind of like stand here and do this, but we can like get around the spinous. I remember Dr. Good showed us that, you can kind of like go on the other side of the spinous and rotate.
From the, facing the patient?
Yeah,
I guess you could maybe.
it's just like getting on the other side, because it's indicating.
You're talking about if you're talking about if you just reach, you're saying reach on this side here
Yes.
and pull this way?
Yeah.
I mean, I guess you maybe
Why
could.
don't we just do it as taught?
Yeah.
I did it on a
I mean,
test.
there's little variations, but it's still just the. Right.
Jake, I did that on a test.
My memories go like.
I did that on a test. I got
This one here, when I did this one,
I know what
here
you're
the
saying.
spinous is to the left. So it's, if the spinous is to the left here, body's posterior here, and I'm pulling this way, it's a left rotation. So the spinus is to the
Yeah,
left,
just do
so,
it as
so
rotation.
if I'm trying to pull on the spinous, yeah, we're this way. Right? And you're grabbing onto the spinus, you're laterally flexing, you're rotating, and you're pulling.
I just guess for your test, if that's okay. It's not out.
Just do the paper
The first one.
annoyed.
Then we have a seated hypothenar pillar hypofenar contact on the anterior portion of the pillar, right? And so you can stabilize the patient, so I think you have to rotate here, right? You add a little bit of lateral flexion to the same side, I think. Yeah. It's done, and then you impulse A to 3.